Ayurveda. It's not just a word, it's a word with everything in it. Over centuries, Ayurveda has helped the humankind because it's not just a word, it's an essence of humans' health, wisdom, personality, mental and spiritual traits all in one. History is the proof that over centuries, humankind has made the most from the science of life and got to the best of their health and achieved their goals in life. Today we have with us somebody who's turned their life for good with Ayurveda. Let's go and meet them and share their experiences with them today. Hello Patricia.
Hello.
Welcome to the show, Patricia, and thank you for taking your time out to speak to us today.
It's a pleasure.
Now, Patricia, from your journey in Ayurveda with Dr. Ashok and your treatment for bronchiectasis, now since you came and saw Dr. Ashok, and from that time to the time you were being treated with him, how did you maintain that positivity on Ayurveda?
Well, we kept in touch by emails. He said to me when I first met him that he would always be there on the other end of the phone, any problems, any queries to phone him. Otherwise, we kept in touch with emails. He wanted to know how I was getting on with the treatment and how I felt. And every few weeks it changed. He would send me a different protocol and I just followed everything to the letter.
So there were lots of changes there?
Yes.
Okay.
Yes.
And with all those changes, were you comfortable?
Yes.
Okay.
It was quite easy to follow. The names of everything were a bit complicated because I didn't understand them, but what I did each time, and I still do it now, I put down everything I have to take for the day. I put it on a notice board in the kitchen till after a few days I just do it automatically because I know what I'm taking all the time.
Right. And throughout your treatment with Ayurveda, with Dr. Ashok, has he changed quite a few protocols?
Yes. It tends to change every couple of months or every 3 months, depending on how I am and what the dose is going to be. Or sometimes it's completely different and I get a parcel with new things in.
Now, because Ayurveda is a very new thing in this modern world for people to hear back about, even though it's traditional, but for modern people now, it's a very new thing to hear about. How does it feel for you following it?
Well, you make the changes into it so it becomes a way of life. And I think it's not just something you're going to do for 6 months. It is a complete change now, and I will follow this pattern now all the time because I'm doing so well on it.
Right. So what does Ayurveda mean to you today?
It means good health, really, and a good quality of health, which makes life a lot better.
Right. And what was it for you 10 years ago?
10 years ago, it was something I didn't really know much about, other than having a brother-in-law that was an Ayurvedic doctor, but I really didn't know the treatments or what it was. I know that when I was in India, anytime I was visiting India, it was very, very popular with the people that lived in India. They would seek out an Ayurvedic doctor in many cases before they would go and see a general practitioner.
So guys, this is Patricia's story with Ayurveda, and she's followed this journey with Dr. Ashok Kumar. So now we are going to be with the man himself behind all this treatment and way of life. Dr. Ashok Kumar is going to join us and we will talk about his way of treatment with Ayurveda and his view on this. Thank you very much, Dr. Ashok, for joining us today.
You're welcome, and thank you very much for having me.
Pleasure.
It's a nice day today and it's a beautiful weather. Hi Patricia, hello, how are you?
Hello Dr. Ashok, I'm very well, thank you.
Thank you very much for coming to Britain. And yes, the weather in Spain is definitely much better. Fantastic. I'm not sure, you might be feeling a little bit cold here.
A little.
Yes, so Dr. Ashok, Patricia is here. It's been such a pleasure to see her in good health and knowing about her journey with Ayurveda, with your guidance. And I want to know, Dr. Ashok, when Patricia first came and saw you, and she rang you for the appointment, and she was actually on her way out of Birmingham the next day. She called you and you had seen her history. You gave her the appointment on the same day. What was the reason for that?
Basically, I always believe in one thing. I always believe that there is a call from nature. There is a call from Creator who created us, and there is a time for everything. Sometimes it's definitely very difficult for me to give an appointment at a very short notice. But when something has to happen, that it has to happen. And sometimes it's the will of the clients. What will of the person. Some people really want to get better. I always say to that everybody really don't want to get better, but some people really want to get better, and they understand the importance of health. And when we have the positive thinking, obviously everything works in the directions. And when Patricia called me, and I'm treating these conditions that she was having from last many years. And then I said, fine, definitely, you come down to us, and then we will try our best to change your quality of life. I'm very confident that it's not we are able to change the quality of life. We are able to do so many things beyond it. But still, I always say to people, let's start working on it, and definitely, we will get our goal. And one thing I really want to is not only outcome is not only depend upon the physician, it's also depend upon the patients as well. And I always say that in any disease or any problems or any health issues we treat, doctors play is only 20% role. 80% role is played by the patient in himself, by the person in himself who want to get better. But today, that is the another challenge we face in the practice, that most of the people, they just want to put everything to the physician. And I just say to them, no, physician is just a tool. Physician is just a way. He can show you the path, but it's depend upon the patients, how he want to take that path seriously in his life. And for one thing, I really appreciate Patricia that, she was very serious about what she wanted to achieve, and she did, so much things for herself, and which makes me feel very happy and make my journey easier of treating my patients. Anyway, she brought those change in her lifestyle, and she was determined to be, gets better. Yes. And that is very important. Yeah. For someone really Indeed. Who want to get better, he has to be positive. He has to be really, work hard towards it. Mm-hmm. So yes, and it's a really, for me as well, it's a journey, enjoying and working for a patient, working along with my patients is really, fantastic experience. Mm-hmm. And nothing better than a physician, when his patient gets better. I don't think so any better gift to a physician given by God to him. It's always, I always feel extremely happy when my patients, feel better.
Yes. I'm sure it's a very lovely experience. And but what was your first impression when you met Patricia?
Yes, obviously when I met Patricia, I know that people don't know much about Ayurveda in depth. So, I always, even though motivate my patients to ask me various kind of questions. And if they have a doubt, really, I always say to them, it's best to be discuss everything now in detail, whatever doubt they have, whatever questions they have. But yes, in Ayurveda, one thing is very important, which we really put in our practice. And we, in Ayurveda always says that we have to understand the psychology of the patient. So when I met Patricia, I know that she wants to get better, and it will be good to work with her. And she is a very determined person. She will really, one day she will definitely achieve much more than what we're talking. Mm-hmm. And today, I'm happy to see her. She's much more healthy, than I can say 4 years ago. Mm-hmm. She's not that Patricia anymore. She is, I seems really 20 years more younger. Yeah, and that inspire me myself, to really live a happy and healthy lifestyle, because I see my life through my patients, and it's really it's a enjoyable journey. And I again want to say thank you very much to her hard work and efforts she put behind her health.
Yes.
And it's a really fantastic experience.
I'm so glad to hear that. And now, looking back and thinking of your strategies on treating bronchiectasis with Ayurveda, what do you think of that? in terms of
Basically,
Ayurveda?
you see, bronchiectasis is a disease which is very well not known into alternative medicine practitioners. Most of the people don't have experience in treating these conditions. And the Western medicine people don't have really, good solution for this problem. They just, what you can say is that they just leave it to the patients and just keep on giving them the antibiotics. Patients keep on visiting them, every time in the hope of that there is they will get something better, something new. But it is not really. Every time they end up having the antibiotics.
Yeah.
And I started treating this disease, 15 years ago. And my all extensive experience and working in this disease, with so many cases, I can say today I'm treating patients more than 20 countries. And I'm really happy to say and proud to say that, we have more than 99% successful rates. Means almost everyone gets benefited with Ayurvedic medicine up to, some people gets 90% benefit, some people get 99% benefit, some completely have a disease-free life, and some really, get 70-80% better. It's depend upon the severity of the conditions and how, seriously patients, take Ayurvedic, system of medicine into their life. And it's really now, people have a hope, when people call me now that, we're really not scared of any more of this disease. We know that you will definitely make us
It's a
better.
lovely
And
feeling.
I know it's a great feeling, but it also brings me under a lot of pressure and a lot of stress. It's not easy to be work according to the expectations of the people. But still, at my corner, I have always one thing. I want to try everything for up to, even though there's a lot of things which is beyond my capacity. I know that, but when you hard work on something, it happens.
Yes. that's
So
true.
my aim is to create something even though much more fantastic for the people who is suffering from this medical condition, and it affects the patient's life a lot.
It does.
If you hear the people really journey, people who is suffering from that, it's not easy. They're not able to really go out. They're not able to do their day-to-day life, and if they have family, they have young children. It's very difficult.
It affects them in
It affects
all
them in
types and walks
yes,
of their life.
because
really.
this disease is very common in female in compared to male, and in today time, female have the more responsibility, and it is usually people start getting symptoms on their 30s, when they are 30 and 40s.
Very
So
young, yeah.
very young time, and that time it's very difficult for them to really cope with these conditions and family responsibilities. So we really it's a challenging,
Yeah.
but
I mean, despite all of this, what strategies would you follow when somebody comes to you for bronchiectasis?
you see, most of the cases of bronchiectasis, always they have a background history of, medical conditions like chronic bronchial asthma, frequent chest infection in their childhood, pneumonia, whooping cough, or any other, medical conditions related to the immune system, or, they are, severely diabetic. So they always have some history. Yeah. In very rare cases, they have very early childhood onset with, based on some genetical medical condition or deformities into the respiratory tract. But usually, it's outcome of most of the chronic conditions like bronchial asthma, pneumonia, chronic chest infections. And if you go deep into this condition, if you try to understand these conditions, and that is, I think, where I say is Ayurveda is much more advanced and much more uniqueness in Ayurveda is that it really focus on the core element of the what I can say in the core issues what the every individual being of bronchiectasis is suffering, the immune system. in Western medicine, we don't have, I can say proper tool, or, we don't have the medications which can help the patients to boost up their immune system. What they keep on trying is, most of the time, they just keep on giving the antibiotics to clear the infection. But in 99% of the cases, infection is always, stay. You're not able to really eliminate it. And after a few months, the infection come back again, then they go for, course of the antibiotics again. And they just get themselves into a cycle, not able to come out of it. And, over the time period, they start developing the complications as well.
There's so much of antibiotic resistance as well.
Yes,
that is coming up because
and then it's become very difficult for them. So by like, my always the first strategical plan in this condition is that I always want to boost up the immune system first, because it's our own immune system which can fight with the microorganisms and which can fight bacteria, fungus, easily, instead of really, injecting a lot of chemicals within our body to kill them. I just want to make our own immune system very, very strong. Along with that, there is another factor, associated factor. Diet and lifestyle is a very, very much associating, factor, which is really very important to treat. Very important to basically focused on, because diet play a very important role into it. Even though people who have a sedentary lifestyle and who don't do much exercise, or the people who really who don't sleep at right time, so all these factors have an impact on immune systems, and that make them prone to catch infection, and ultimately they end up developing these medical conditions. So I always motivate people to have a healthy lifestyle and healthy diet. So the first the line of management and focus is on the immune system. Second, we focus on the diet and lifestyle, and thirdly, positive thinking anyway is also again very important. And when you are getting treatment and when you want to heal, because as positive you feel about yourself, our healing system and mechanism works much better.
So you assess your patients on, so you assess anybody with bronchiectasis with all these different aspects of the person itself. And is that, or is there anything else that you think of?
Basically,
what makes Ayurveda unique?
The uniqueness about Ayurveda is, as I mentioned before, that we don't look into the disease in particular. I look into the patient as a whole. Even though I look into the circumstances, his social life, his family life, his working life, his dietary habits, his thinking, either how he thinks, how he takes his life. We call it a constitutional analysis. We always really look into, all those factors, because which is a very, very important factor. Disease in itself, when you try to treat any disease in itself, we don't get very far anyway, because ultimately that means we are treating the disease symptomatically. Disease is still within our body, and that that is the major challenges today. Western medicine science face is that they just focus on the symptom of the conditions. They don't look into the other circumstances which affects us in our day-to-day life. So in Ayurveda, we really take a very broad spectrum, overlook to the patient's lives, and then we try to address and guide them through on every aspect. If he is not thinking positive, we motivate them to think positive. If he is not eating a healthy way, we always motivate them to follow the healthy diet and lifestyle. If he seems to be stressed, we're trying to give them tips or guide them to manage the stress. And then it comes to the further management of the bronchiectasis, for the management of the diseases, and that's path we follow in most of the treatment in most of the medical conditions.
So there's a lot of different aspects about bronchiectasis and the person itself that you look at together. But how does it make a difference to the person you being treated, or to yourself, when there is such a big difference between where they are and where you are? Like Patricia, you are from Spain, and Dr. Ashok, you from Birmingham. So there's such a big difference, and you said you treat patients in 20 different countries. So how do you manage to kind of look at every aspect of the patients and guide them through this condition?
Basically, definitely technology is here play a big role today time. I think distance is not a matter. Doesn't matter where we're living in this part of the world, we are still able to connect. And one important thing about it, about this Ayurvedic system of medicine is that in Ayurveda, you just not become a doctor. There's a, I always say to them, Ayurvedic physician is not like, you have to have a mindset of a healer. You have to have a very, very spiritual mindset along with a mindset of a physician. And ultimately what happens is you really, develop that kind of a senses, that kind of intelligence that you are, by even though seeing your patients, what exactly happening here. That, what's my patient is facing the challenges and problems. So it's connected with them very, very well. And God bless, I always thanks God that, sometimes I feel He just made me to be a physician. He given me that intelligence, IQ, that, I'm able to understand their body, mind, very, very easily, and then connect with them nicely. And I never treat them as my, I always don't treat them like a patient, to be frank. I always become their friend. I guide them, I work with them, and every questions they put forward, that I take it with positivity. I have a record that some patients send me till now 400 emails. So, I have the record of that, and I responded for 400 emails. Can you imagine? So, I have a great patience, in that regard, because they have a doubt, they're suffering anyway. And as a physician, I feel it's my moral responsibility to really take their doubt out, help them to get better.
Yeah, and this is in the modern lifestyle. This following Ayurveda is a completely new system to follow. There's so many questions that come up, and I'm glad you take your time out to answer everybody's questions. And email, Skype, everything is bringing patients and doctors closer as well in a way.
Yeah, there is you see, still, I believe in the West, Ayurveda faces another challenge of skeptical, IQ of the society to the Ayurveda. And I don't think so it's a society fault, because I myself as a physician, when I start, learning Ayurveda, I was very skeptical about it. And, Patricia, if I take you a little bit back to my self-history, how I'm becoming an Ayurvedic physician. I entered into Ayurvedic medicine, and when I was studying Ayurveda, I was the students where I used to very skeptical. When people bring me a lot of questions, I smile, and they say sometimes they feel, oh my goodness, we're asking Dr. Ashok so many questions, but they don't know my history, my past. I used to be very skeptical Ayurveda. I used to hate Ayurveda, what I can say. Whatever written in the textbook, I used to laugh on that subjects. I said, my goodness, what's a rubbish informations. It is not scientific. There's no trial about it. There is no evidence about it. And how we going to really, implement all these things, in today's life and present life. And my teacher used to always used to come near to me and used to say, don't ask us any questions in the classroom, because I used to disturb them for every single minute. My hand used to be up. I used to, ask them so many questions. And really hardly they are able to answer it, because I was so curious.
A lot of challenges there.
A lot of challenges. Yes, basically, I still remember those days, I remember that day, many years ago when Patricia comes to see me, is around 4 years ago. And, but she's not, she looks completely different now. And I really want, when I seen you, I was thinking, my goodness, I should take my Ayurvedic medicine myself regularly to make myself feel more fit. Yes, she's not that Patricia anymore, and I'm really happy to see you very healthy and happy. So how you feel, Patricia, now? How was your journey, really? We talk a lot, over the phones and time. I seen your emails. And
thank God for technology.
Yes, thanks for technology. Yeah, here I can say yes, thank you to technology. Yes. But seeing each other after 4 years is a different experience, isn't it?
It certainly is.
We both look different.
We do. And I think it's been very easy, because I've always been able to contact you. You gave me your phone number and said any problems, either email or phone you straight away.
Yeah.
And if I had anything I didn't understand, to ask. And I have done.
Yes.
And you've always answered, because I've always needed that feeling that the backup system
Yes.
was not in England, but
Yeah.
you were just sort of around the corner from where I live in Spain,
Yes.
because you were easily accessible,
Easily
which made a
accessible.
big difference
Yeah.
to how I felt, because to start off with, I was not well.
Yeah.
And then it was a gradual journey for the first few months, but for the last almost 2 years, I have been back to perfect health,
Yeah.
and I'm staying that way.
Yes, because it is also my belief, Patricia. Definitely, I always motivate my my all the patients, that all my clients, when they comes to see me, I always says to them, just drop me an email. It takes you a few seconds. I want to see what's happening. How you're progressing, and it is a very important part of healing system. Today time, it's very unfortunate to say that this relationship is become a very very they say it's a professional relationship, but you can't treat patients without emotions, love and care. In that
Yes.
professionalism, we need that that care. We need that very positive attitude, but which is lacking today medical science system. And that's where we are failing today. There's not much connections between patients and a physician.
And they have very little time.
Very little time. And that really, in my practice, I always wanted to eliminate that factor. As per my capacity, I always motivate my patients to write me back.
Yes,
You
and
know-
it's a new science to follow. People don't know so much about it, and to have so much support from yourself, it makes the life and the journey with Ayurveda so much comfortable.
It does, and it's very important that you've got somebody that can answer questions and is easily accessible.
Yeah, because it's very important, because patients can have a lot of ups and downs. They are really, because they have this first-hand experience of this medical condition. So there is sometime, I give you a classical example. Sometime when they cough and then there's a streak of blood into their cough, they become nervous, they become panic about it. So they really want you to contact someone else, and I always says to them, reassurance. And it's very common in bronchiectasis cases that, they can sometime have a streak of blood. So most of the time, they're not able to connect with their physician, they get panic, they get stress, and it leads to sometime panic attack and anxiety. So I always says to them, no, just call me, I'm just drop me an email or contact with us, so we guide you through anyway nicely. Because I've seen, so many people, I have a very extensive experience in treating bronchiectasis, and my experience is through so many people's lives. So you see people at a different stage when you treat them. Somebody, even though are, with these conditions, can be in the list of like lung transplants. So we treated cases from very, minor to major, severe cases, what I can say, when they don't have any hope. We're really also able to change those people's lives. But yes, we definitely, I always say to people, I need to have, I expect the positive attitude from your side and that support as a physician myself to treat you with the best way.
It's very important, and
Yes.
also you give people hope.
Yes,
which
that's right.
Up until then,
Oh, yes.
they haven't had, because
you're
people
right.
say, can't do any more for you,
Yes.
it's a life of antibiotics.
That's
But
right.
in my case,
Yeah.
it's given me a new lease of life.
Okay.
So, Dr. Ashok, what is your view on Ayurveda and bronchiectasis, treating patients with this?
Basically, first of all, I wanted to really say to all the viewers and all the people that whenever they get diagnosed with this medical condition, they no need to be worried. They no need to be get worried about it. We are just really, one phone call away from you, or you can simply send us an email. We have a very extensive experience in treating that. When they get diagnosed with this medical condition, their world turn around other way. They just get scared of it. They start searching on internet, they start reading on internet. Instead of that, just send us an email. We are going to be there to help you. And we are highly experienced and have a in and out knowledge of treating this condition by using Ayurvedic medicine. And Ayurvedic medicine is able to change of so many people's lives. So don't get scared, don't get worried about it. And the best important thing is that, Ayurvedic medicine is safe to take and it's very effective in the treatment of bronchiectasis.
Right. Thank you very much, Patricia, and thank you very much, Dr. Ashok. So, viewers, this was our information about bronchiectasis in this session, and I hope you find it very useful. If you would like any more information or would like to connect with Dr. Ashok, Ayurveda Clinic in Birmingham, please do so. He's just round the corner to kind of give you support a phone call away. And please do not forget to subscribe us, press the bell icon. You can connect with Dr. Ashok Ayurveda Clinic on Twitter, Facebook, and please continue watching. Thank you for following and watching today.
If you need more information, please subscribe to this channel for any more help from Dr. Ashok, and whatever help you receive could change your life as it changed mine. Good luck with the future.